We are the RX Squad, and here's our case presentation. Bernadette Wallowitz is a 26-year-old woman who has come to your pharmacy for some help in selecting an over-the-counter medication to treat her constipation. Bernie takes a prenatal vitamin daily, Tums for occasional heartburn, and occasional chlorpheniramine for seasonal allergies. She has an allergy to penicillin that resulted in a rash. She reports that every once in a while she feels really bound up and bloated. Bernie is hoping you can suggest a product to relieve her occasional constipation.
After reading the case, these are some questions to ask. It is important to know if the patient is pregnant, what drug intolerances, if any, does the patient have, such as headaches and stomach complications. It's also important to get a current medication list from the patient, so that will include the start date and inherent notes for the medications that the patient is taking, including drug interactions and dosage instructions. It is also very important to collect the patient's social drug history, including caffeine use, alcohol use, tobacco use, and recreational drug use, knowing the patient's herbal supplements, and also using open-ended questions to know her constipation symptoms.
This is the subjective background of the case. BW is a 26-year-old female experiencing occasional constipation. She says that she gets bound up and feels bloated once in a while. There was no objective background available for this case.
Based on the information that was given, the patient is on these current medications. She is taking a prenatal vitamin of unknown strength and dosage form. It is also unknown if the patient is pregnant or not. She's taking one vitamin by mouth once daily with an unknown start date and no adherence information. She's also taking Tums of unknown strength and dosage form for her occasional heartburn. It is unknown how she's taking these medications and also unknown of when she started these. And lastly, she is taking chlorpheniramine of unknown strength and dosage form for her seasonal allergies, again with an unknown information of how she's taking these, unknown start date, and unknown adherence behavior.
This drug therapy problem is indication. She needs additional drug therapy, and Bernadette needs additional drug therapy for her untreated constipation. The goal of therapy for this patient is to eliminate signs and symptoms of constipation, such as a bloated feeling, and restore normal bowel movements within 7 days on April 25th, 2017.
Therapeutic options to treat this patient's constipation include Citracel powder and Dulcolax laxative tablets. Our therapeutic plan for BW includes the continuation of her 3 current medications as well as the start of Citracel powder. If BW is pregnant, a fiber supplement or a stool softener are the best to treat constipation. Citracel is a fiber supplement. Dulcolax is a stimulant laxative. So Citracel is a safer choice for BW since she may be pregnant. Instructions for use of Citracel powder are to add 1 heaping tablespoon of powder to an empty glass and add 8 ounces of cold water. Stir briskly and drink by mouth immediately once daily.
Some non-pharmacological interventions for this care plan include increasing physical activity, increasing fiber intake, keeping a stool diary, which includes the number and characteristics of bowel movements, and drinking 64 fluid ounces of water per day, which is approximately 2 liters of water.
Our first follow-up will come 1 day after the encounter. It will be in the form of a phone call where we will focus on monitoring for safety. We will evaluate for side effects such as chest pain, nausea, vomiting, abdominal pain, rectal bleeding, and anaphylaxis. 7 days after the initial encounter, we will follow up with another phone call. We will again evaluate for side effects. Also, we will monitor for effectiveness of the Citracel. We will evaluate for total number of bowel movements, characteristics of bowel movements, and if any stomach pain persists. If any of the symptoms are still present, we will refer BW to a primary care physician.
These are the references that we used. We used both Micromedics and the website for Citracel.